The decrease in COVID-19 infections for the better part of the month of September was a probable indicator the country was finally flattening the pandemic's curve. This saw the government move ahead to ease containment measures that were in place, including reopening of bars as well as schools. The last 1 week, however, has cast the government's efforts in futility. According to the Ministry of Health, there is no sign of relenting from the disease as it now seems to be getting into the second wave.
We are also witnessing high ICU cases, including in counties such as Isiolo, where there has never been an ICU case, but now we have them. Today, we have 28 cases in ICU and closing very quickly towards 1,000 admissions in health facilities. This is not even counting those who are in home care.
If you go back 2 months or thereabouts, our admission rates were about 450 cases in all the institutional facilities. Today we have 991. So that figure has more than doubled in the past 2 weeks or so. That tells you that whatever is happening at the community level is that we have widespread community transmission of the disease, and more people are coming to the facilities.
In a period of 1 week, over 70 people have succumbed to the disease, whose devastating effects seem to be endless. Unfortunately, young people between the ages of 18 to 29 account for 59% of the deaths recorded so far.
It was 4%. A day later, on October 2nd, it rose to 7%. On October 3rd, it went to 8%. And it has been, in the period since, marked a consistent upward trajectory. Today, at about 13% incline and a daily rise in deaths, we can confidently point to a potential crisis unless we take some immediate actions to avert this.
Political rallies have also been another silent spreader of the disease in the community, with the ministry now urging leaders to be responsible. On the flip side, however, Kagwe has called on Kenyans not to attend political rallies to help curb the same.
Sometimes, even the citizens themselves make it very difficult for the politicians not to have those rallies. Because if a politician is driving around or getting out of a meeting and you gather around and you stop the person, the politician, from moving, you cannot really blame that person for beginning and starting to address those people. So it is not just the political class, it is also citizen responsibility.
Prisons have also become another stronghold for the spread of COVID-19 as more cases continue to increase, emanating from the facilities.
And what is also unique in this second part of the infection is that all age groups are affected. We are losing more and more people who are younger and who don't have any coexisting medical conditions.
As he announced 685 new COVID-19 infection cases in Kenya, Health CS Mutahi Kagwe spoke of a potential crisis and warned young people against flirting with the deadly disease. In terms of the number of recoveries, Kagwe reported that 105 more people had been discharged, 73 from treatment at home and 32 from hospitals, raising the number to 31,857. Sadly, 7 more deaths had raised Kenya's death toll to 832. Dana Rose, K24 for The Punchline.